Welcome to Sleep Better TV. Today my guest is Dr. Steve Lawson with the TMJ and Dental Sleep Center in Winnipeg. Dr. Lawson, it is a great pleasure. Welcome to the network.
Well, this is my pleasure. My pleasure, absolutely.
Well, let's begin by talking about how you got involved in treating sleep disorders as a dentist. Talk about that a little bit.
Yeah, it was a bit of an evolution for me. Initially, even shortly out of dental school, graduating, I was very interested in orthodontics, and that led me fairly quickly into an appreciation for what is called, functional jaw orthopedics, which is with children, of course, which is a matter of being able to move the jaws and manipulate growth and development so that you can appreciate for these kids better faces and better airways. Mm-hmm. It didn't take long for the educational path I was on to take me to a serious look at temporomandibular joint disorders, which was the adult version of what we were doing for the kids. And initially we would be looking at TMJ dysfunction and pain and clicks and pops and all sorts of craniofacial pain issues. And knowing that we could do the same thing with adults as we were able to do with the kids in terms of at least stabilizing joints in the correct positions. Initially, there wasn't much of a regard for the airway when those studies were started, but we did know that we had to treat patients differently at night, dealing with parafunction, clenching, and grinding to help them with their TMJ pain than we did during the day. Mm-hmm. And eventually, the whole issue of sleep disordered breathing and mandibular repositioning was being looked at very closely in terms of the effect on the airway. So the transition for me was a gradual one over most of my career. I've been a bit of a continuing education junkie, and it was only after I got involved in TMD treatment and became aware of the implications of sleep and airway on treating these patients that we looked closely at airway. And now it's just been a burgeoning clinical revelation in terms of treating people with sleep-disordered breathing.
Give us some idea of some of your success stories when someone comes in and presents with chronic pain. And, obviously sometimes there is a relationship with that in OSA, but just talk about how the successful treatment can positively affect someone.
Well, I had a lady in here, interesting, just today, who was on a recall basis, who had been everywhere and seen everybody about her pain and her dysfunction. I mean, she had headaches and she couldn't sleep, and she was a mess, and she couldn't even work. And she was in for just a recall. And we do this with our patients. We like to see them on a periodic basis to check the appliances, to check their teeth, just to make sure that there aren't things brewing that the patient might not be aware of yet, that we can perhaps, cut off at the pass, so to speak, or safeguard against. But she's a young lady. She's probably 25, 28 years of age, and she just, she couldn't thank us enough. Her life has changed. She wished somebody had referred her here, or she had been able to have this kind of conservative, non-surgical treatment with such high success rates like many, many years ago. Not that long ago, a lady left the practice here and went downstairs to get into her car, and next thing I knew, she was just starting treatment, and she was at one of her progress visits. So she wasn't just starting, but she went down to her car. So we monitor them through treatment to make sure we're getting the results we expect, and if not, to make whatever changes we have to make. Well, she comes up and she's in tears, and I'm thinking, oh boy, what went wrong? Well, I guess she's in her car, and she was backing up, and she couldn't believe that for the first time in maybe years, she could actually turn her head to check behind her, to do a shoulder check as she was backing up. So she just wanted to come up and just express her gratitude. Moms and the kids, who even the younger ages, boy, we get a lot of hugs and we get a lot of baking and things in here, and it's a very humbling experience, but extremely rewarding when you can live your professional life this way.
Well, Dr. Lawson, it has been a great pleasure meeting you and hearing about your practice. Thank you for sharing your time with us so much.
My pleasure. My pleasure.
My guest has been Dr. Steve Lawson with the TMJ and Dental Sleep Center of Winnipeg, and you're watching Sleep Better TV.